Hello everyone, my name is Dr. Sahiba Singh. I am the Assistant Director at Global Institute of Stem Cell Therapy and Research, Chandigarh branch. We are an established institute of regenerative medicine in the region, bringing this advanced science to the masses. On behalf of my entire team here at GIOSTAR, I welcome you all to the Part 1, Arthritis, of our webinar series, New Age Treatment Modalities. This series is aimed at educating and informing all of you regarding regenerative medicine, its various applications, its supportive branches, as well as opening a communication channel with you for further inquiries.
Bringing this advanced science to the
I'm pleased to introduce our first key speaker, Dr.Amandeep Singh. He is presently heading the Department of Physiotherapy at Chandigarh University, has served as the Principal of Physiotherapy in Gyan Medical College, has a vast experience of 13 years in rehabilitation procedures along with his PhD and Masters in Osteoarthritis. To give you an insight about the pathology of osteoarthritis and how physiotherapy along with regenerative medicine as a supportive branch can help our patients in vast general.
Thank you, Dr. Sahiba, for inviting me for this lecture. I, Dr. Amandeep Singh, would like to extend my thanks to the team GIOSTAR for inviting me for their first series of webinar, which they have planned for you all. Today I am going to speak to you regarding arthritis. Introduction to new age solutions, how the management strategies for managing the arthritis patients is evolving with time. In the first slide you can see some beautiful flowers, but I would like you to focus on the fingers which are holding those flowers. See the status of the fingers, they are like so much deformed only because of one thing, that is arthritis. So if I would like to say what is arthritis, it is basically made up of two words, arthro and itis. Arthro means joint and itis means inflammation. So since inflammation is there, it is associated with pain, and in arthritis it can be single joints that can get affected, it can be multiple joints that can get affected, and to your surprise, I must say that more than 100 types of arthritis exist with variable causes, and definitely if there are variable causes, so the treatment approaches are also very different. All the age groups can get affected with this arthritis, and women are getting affected more with this. So many reasons for this: the living style, how they cope up with their daily life, everything is contributing. Then overweight individuals who are obese, they are like more prone to arthritis, and if there is any predisposing injury to the joint, that can also be the reason for the increased incidence of arthritis. If I talk about few of the common types of the arthritis, there are basically two main types of arthritis that is present. First one is osteoarthritis, second one is rheumatoid arthritis. And both of these are having very high incidence worldwide. And all the age groups, again, as I have already told you, can get affected with these. Briefly about osteoarthritis, it is the most common amongst the two types, which are like common kinds of arthritis. And almost 80% of the adults above the age of 55 are having osteoarthritic changes on X-rays. And out of that, almost 60% are suffering from symptoms associated with osteoarthritis. And approximately 240 million adults are affected worldwide with this menace. And it is associated basically the wear and tear of joints. Like it is more you use, more it is getting affected. And osteoarthritis is basically the middle-aged people or elderly people which are getting affected more with this problem, and women again, due to their, as I've already told you, due to their lifestyle, due to their working postures, are getting affected more. And most commonly are affected are the weight-bearing joints on which we put weight. Like for that reason, lower limb joints are getting affected more than the upper limb joints. Like knee joint is getting osteoarthritis very commonly, and then hip joint. If I talk about contributing factors which are contributing to your osteoarthritis, first one is a first and primary history of any trauma to the joint. If you are having any trauma to the joint surface, then there is very high risk that you are going to get the osteoarthritis changes sooner. And second one is weight. More is the weight, more is the chances of getting the osteoarthritis. Then working posture. If your working posture is such that you are continuously putting strain on your joints, that time again it is like very high chance that you can get osteoarthritis. Then your foot and footwear are also contributing to development of joint pains, which can gradually lead to early onset of osteoarthritic changes. Then gender, as I've already told you, it is the females who are more prone to osteoarthritis than males. If you are keeping your joints less mobile, definitely you are going to get more, there is more chance of onset of osteoarthritis. Then overall nutritional status of your joint, of your body. If you are taking less essential nutrients in your diet, there is very high chance that you are going to get weakened bone, and ultimately it can lead to increased stress on your joints, and finally the osteoarthritic changes. Then underlying metabolic diseases like diabetes is also going to contribute to the early onset of osteoarthritis. Then genetics, your genetic vulnerability is also there. Like if your parents are having the osteoarthritis, there is very high chance that you are also going to get it. Then repeated stress, particularly occupational. Those who are like working in a wrong style, or like those people who are working in some industry where continuous strain on the joint is being put, that micro trauma is causing the can lead to early onset of osteoarthritis. Then if there is like some joint deformity is there, like some congenital deformity is there, or due to some injury you get some deformity in your joint, that can also lead to uneven pressure on the joint, finally leading to the osteoarthritis. Now if I talk about the types, basically there are two types of osteoarthritis. First one is primary osteoarthritis and secondary. Primary is like normally like gradual onset with the age, and secondary is associated with some underlying cause like previous history of trauma or previous fracture in your lower limb can lead to early onset of. Basic structure of synovial joint is synovial joint, or joints like knee joint is there. The pic is of knee joint. Synovial joint is composed of connective tissue. Connective tissue helps in dealing with the mechanical loads encountered during our daily life, and most important amongst that is articular cartilage, which is the main culprit in this onset of osteoarthritis. And the articular cartilage is getting the nutrition from weight bearing. Now, as I have already told you, if you are putting less strain on your joints, your articular cartilage is not going to get the nutrition, and this can lead to a degeneration of your articular cartilage. About the stages of the osteoarthritis, basically it is divided into 4 stages. I have tabulated that. Stage 1 is like minor. This is just onset of pain or no pain with minor wear and tear. There is no change in the joint space with no osteophytes, or very small osteophytes can be there. Then stage 2 is mild one with mild pain, hardly 1 to 2 on the 10-pointer scale of visual analog scale. Then cartilage, proteolytic breakdown of matrix starts of the articular cartilage with minor changes in the joint space and small osteophytes. Stage 3, in this stage the patient starts experiencing moderate pain with activity, and stiffness is also there, because due to pain the patient's tendency is like to give rest to the joints, which can lead to stiffness. Articular cartilage erosion starts and joint space narrowing occurs, and crepitus, that rattling sound in the joint starts coming in grade 3. And stage 4 is severe with marked pain in ADLs. Patients feel pain during taking rest. Patients feel pain with activity, with hardly any position within which the patient is not feeling any pain, and associated stiffness is also there. Then significant wear and tear of the cartilage occurs. Now, if I talk about signs and symptoms or clinical presentations with which the patients will feel, the primary complaint is that of pain. Then the patient will say, pain, I am having pain in the joint surface. It can be like if there is pain, there is increased tendency of the patient to give rest to that joint. This can lead to reduced joint of motion and finally the stiffness. Then tenderness will be there. Patient will say at one point where I am feeling pain, then loss of flexibility is there. Crepitus, I have already told you, grade 3 and grade 4 are marked by crepitus. Then later stages it can be swelling also and hard lumps due to underlying osteophytes or meniscus, particularly in grade 3 and grade 4. The next more common type of arthritis is rheumatoid arthritis. It's not only the disease of the joints, it is a systemic disease which can affect your body organs as well as your various physiological systems of your body. This is an autoimmune disorder, which means your immune system is attacking your body again. And all age groups can be affected with peak in the middle age group. It can be like, it can affect children, infants are also getting affected where they are born with still diseased. Then children can get affected where they are suffering from juvenile rheumatoid arthritis. And if I talk about gender, again women are more prone for this disease than men. Almost 2.5 to 3 times they are more affected in this. And in this the patients complain of swollen, swelling, then painful and heated joints. If I talk about probable causes of rheumatoid arthritis, the primary one is genetic predisposition, where the patient, if any of the parent is having this problem, there is very high chance that one of the kids is going to get this problem. Then stress is also contributing to the onset of the rheumatoid arthritis. Like stress will lead to decreased activity level, which will ultimately lead to hormonal changes, and finally the onset of rheumatoid arthritis will be there. Then dietary deficiencies, nutritionally deficient diet is definitely going to contribute to the onset of rheumatoid arthritis. Then sports injuries or medical operations again going to lead to decreased activity level. And finally, the onset of rheumatoid arthritis can be there. Then infection-causing organisms like bacteria and some viruses are contributing to this. Allergies, chemical sensitivities, pollution, metal toxicities, intake of harmful chemicals and hormonal imbalances, weakened immunological system, all are going to contribute to this. Then risk or aggravating factors, again gender, I have already told you that women are more prone for this. Almost 3 times, 2.5 to 3 times they are more prone. Then middle-aged people are very much prone to this. Any family history or genetic predisposition, smoking, environmental exposures, obesity are all going to contribute to this problem. The clinical presentation in this includes patient will complain of morning stiffness, particularly in small joints of hand. This can be associated with compression of nerves, producing carpal tunnel syndrome. Patient will complain of tingling sensation in the hand, or polymyalgia rheumatica, where the patient will complain of pain in the back of the head. Associated with inflammation of large arteries, periarteritis can be there, characterized by aching and stiffness, night sweats, generalized or ischemic muscle pains, undue fatigue, pain in all the symptoms which are like contributed by the reduced blood supply. Then symptoms associated or triggered with severe trauma, emotional problems, surgery, pregnancy. Then there is gradual involvement of more joints as there, then weight loss. Now if I talk about management strategies for this arthritis, the aim of the treatment is reduction in pain, then prevention of stiffness, prevention of deformities, improvement in, if all these will be sought out, then there will be improvement in the quality of life, prevent muscle wasting, preventing systemic complications, particularly in cases of rheumatoid arthritis. For reduction of pain or stiffness, there are various modalities which we can use is rest, thermotherapy, application of heat, then cryotherapy, application of ice, range of motion exercises, joint mobilizations with distractions, then endurance exercises we can give, then strengthening exercises we can give. Now, if management strategy, if we talk about osteoarthritis, there are basically three management strategies for this. First one is pharmacological, where we can recommend pain relieving medications. Then surgical is there, where the final joint replacement or joint osteotomy is there. Then non-pharmacological treatment is there. In this, much emphasis has been put on this due to the harmful effects produced by the medications. And physiotherapy in this forms a mainstay of treatment for in non-pharmacological management of osteoarthritis. In physiotherapy, we basically make use of electrotherapy as well as exercise therapy. Electrotherapy involves application of various electrical modalities. Exercise therapy involves the application of various types of exercises to the patients, which can be endurance exercise, which can be range of motion exercise, which can be strengthening exercise. Now, strengthening exercises again are an important part because due to pain, due to muscle stiffness, due to joint stiffness, it can lead to muscle wasting. So, strengthening exercises are of very importance for these patients. And now these exercises we again categorize into open kinetic chain and closed kinetic chain according to the symptoms of the patient. So these exercises are recommended or advised to the patients based on their symptoms. It cannot be like it is not a generalized formula that all the exercises can be given to anybody. Due to its widespread presentation, we make use of NSAIDs medications, non-steroidal, then disease-modifying anti-rheumatic drugs, then corticosteroids, immunosuppressive drugs, and rest, nutrition, exercises, joint protection, splints, all we make use of everything for these patients. And this is a few joint protection techniques. Rheumatoid arthritis is associated with various deformities in your hand. So splints are advised for these patients so to avoid the development of any deformity in the hand. So now I would like to hand over the proceedings to Dr. Sahiba because many patients are presenting with very severe systemic symptoms. That's why innovative methods need to be developed for the management of these patients. So, Dr. Sahiba, please come forward. Thank you.
Thank you, Dr. Amandeep, for this insightful lecture. As Dr. Amandeep has already highlighted the importance of articular cartilage in the pathogenesis of osteoarthritis, I would like to build up on this. As we all know that osteoarthritis is not caused due to one reason. It has multiple faceted reasons for it. One of the prime reasons is the chondrocyte degradation. That is basically the cartilage degradation which can occur due to various factors. Prime of that is apoptosis. The apoptosis can be defined in general as the cell death. Primarily in this case the chondrocyte cell death. There are certain factors which are released by the mesenchymal stem cells used in our facility, particularly the adult mesenchymal stem cells, which when delivered directly in the joint via intra-articular injection leads to the control of this apoptosis. Along with that, an increased fibrosis in the joint also leads to restriction of movement, which is then followed by stiffness and a decreased movement in terms of physiotherapy by the patient as well, and worsening of the disease. The pain which is caused due to osteoarthritis is basically due to an increased inflamed reaction and patient restricts the movement. This is also down-regulated by the immunomodulatory mechanism of the mesenchymal stem cells. Besides that, when we are giving a patient mesenchymal stem cells, they are just not given intra-articular. There is an IV administration of the same. This was basically concerning our prevention of disease modality. Now we have to shift to the regenerative part as well. There are certain factors in the body which are already active in an osteoarthritic patient, out of which the stem cells actually stimulate the pro-chondrogenic factors which are responsible for increasing the cartilage mass in the osteoarthritic knee. Hence, by these three main mechanisms, along with physiotherapy and a proper diet regime in case the patient needs to have a weight control to decrease the amount of work put on the knees, we are able to support our patients. There are various grades of osteoarthritis. Based on that and the comorbidities which the patient can face depending on diabetes, hypertension or any other comorbidity, we have a regime to follow the eligibility criteria in which the patient can be educated regarding the eligibility and prognosis, that is how much the patient can benefit. Not all patients can be eligible for regenerative therapy, but this is definitely a modern, non-invasive and least side effects prone regime which can be followed by the patient. So having talked about regenerative medicine and few of its potential applications in the orthopedic field, now I would like to introduce Dr. Nandita Basu, MD. She is the former director of Calcutta School of Tropical Medicine under Govt of West Bengal, has had an extensive career spanning over 10 years with over 60 publications in national as well as international journals, has worked in specialized fields of hematology, regenerative medicine, cyto as well as histopathology. Today we have her here talking to us about the potential use of regenerative medicine as an important therapeutic tool in current as well as future clinical scenarios.
Role of mesenchymal stem cells in current and future clinical scenarios. A mesenchymal stem cell are a type of stem cell which originate in the mesenchyme, an early developmental tissue of the embryo that will develop into various types of connective tissue. They are considered to be multipotent, a type of stem cell which has not yet adopted any specific phenotype and has a potential to differentiate into a wide variety of specialized cells. Although the mesenchymal stem cells are primarily derived from the embryos, they may also be extracted from umbilical cord tissue, forming the basis of popular trend of cord stem cell banking. Mesenchymal stem cells were originally found in the bone marrow, but they constitute only about 0.001 to 0.01% of the total bone marrow cells. Bone marrow contains variety of cells like hematopoietic stem cells, and other sites where the mesenchymal stem cells are found are the umbilical cord blood, peripheral blood, adipose tissue, etc. Mesenchymal stem cells, under certain conditions of cellular culture, can differentiate into a variety of cells like bone, fat, cartilage, neuron, hepatocytes, etc. The function of normal immune system is to protect the body from invading organism. Infection occurs when the immune system cannot detect and eliminate the foreign organism. Sometimes the immune system do not recognize its own body's cellular components and attacks them as foreign, resulting in autoimmunity. Currently, we treat the autoimmune disorders by anti-inflammatory agents, immunomodulatory and immunosuppressive drugs like steroids, inhibitor proteins that antagonize the activities of inflammatory cytokines. But the immunomodulatory properties of the mesenchymal stem cells can be utilized for therapeutic purpose also. The microenvironmental factors in inflammatory conditions determine the immunomodulatory functions of the mesenchymal stem cells. The anti-inflammatory and immunoregulatory effects of mesenchymal stem cells are seen in the regulation of lymphocytes of the innate and adaptive immune system. Due to their immune-invasive nature, the mesenchymal stem cells release immunomodulatory factors which allow them to escape rejection mechanism and exert therapeutic action. An increasing number of evidences also suggest the following facts about the mesenchymal stem cells. The mesenchymal stem cells can modulate the proliferation and function of the T cells. they can regulate the activities of the T helper 1 and T helper 2 cells. The functions of regulatory cells can be upregulated by mesenchymal stem cells. Mesenchymal stem cells can repress the function of the B cells. The proliferation and function of the natural killer cells can be impeded by the mesenchymal stem cells, and mesenchymal stem cells can block the maturation and activation of the dendritic cells. These properties of the mesenchymal stem cells has been utilized for the treatment of different pathological conditions like autoimmune disorders, degenerative diseases, traumatic injuries, and recently in cases of COVID-19 due to decrease the severity of symptoms and increase recovery. The U.S. Food and Drug Administration (FDA) has already approved the clinical trials to study COVID-19 patients who have been administered the mesenchymal stem cells derived from the placenta to prevent inflammation of the lungs. Dr. Mohan Wani from the National Center of Cell Science reported that the advantage of the stem cells is that they have a strong anti-inflammatory and immunomodulatory property which can help to strengthen our immune system. This is important in case of COVID-19 where they could reduce inflammation of the lungs, which are the mostly affected organ. The two recent studies from China have asked, can mesenchymal stem cells treat COVID-19 patients suffering from pneumonia based on immunomodulatory and reparative properties of the stem cells? Both studies reveal remarkable reversal of the symptoms even in severe critical conditions. Accordingly, these clinical studies not only identify a novel therapeutic strategy but also the existence of natural mechanism able to counteract acute inflammatory pneumonia. One study is a case report of a critically ill COVID patient on a ventilator who had progressed despite intensive therapy with markers showing evidence of liver injury. This patient was treated with allogenic human umbilical cord mesenchymal stem cell using 3 intravenous infusions for 3 consecutive days apart. Within 4 days, her second cell infusion, the patient was off the ventilator and able to walk. So to conclude that focusing the efforts toward achieving standardized methods of mesenchymal cell isolation, characterization and administration has great potential to develop promising new treatment protocols with mesenchymal stem cells or mesenchymal stem cell derived products. While analyzing the mechanism of the mesenchymal stem cell function, we can see that each mechanism plays an important role in rescue and repair of the damaged tissue or organs. Following mesenchymal cell administration, leading to improvement in the treatment, safety, efficacy, and predictability of outcome for the patients suffering from different disorders. That is how we can open a new era in the therapeutic world to treat the moribund conditions. Thank you.
Thank you, Dr. Nandita Basu, for these insightful thoughts on regenerative medicine. With this, we have come to the conclusion of part 1 of our webinar series. Following this, we shall have our contact information displayed for you in case you have any queries.
Creating a positive and significant impact for human race is our primary goal. From research to treatment is our purpose.